Good evening. Welcome, everyone. I want to thank you so much for joining us for the final session of our Ovarian Cancer Wellness Symposium. Our topic tonight is going to be brain fog, signs, symptoms, and the important coping techniques that will help you in your daily life. I want to say that this program is made possible by individuals and partners dedicated to providing learning opportunities and a platform for our teal community to be inspired. I would like to extend a special thank you to our presenting partner, Northwell Health, and to our national partners, GSK, Merck, Eisai, and Novocure. At this time, I would like to introduce you all to our guest speaker this evening, Dr. Chanel Davidoff. Dr. Davidoff is a board-certified physical medicine and rehabilitation physician who specializes in cancer rehabilitation at Lenox Hill Hospital with Northwell Health. As a cancer rehab physiatrist, she supports patients through the entire cancer care journey, from diagnosis to survivorship. Dr. Davidoff, can you begin in tonight's discussion with first explaining what is a physiatrist?
Hi, yes, Stephanie, thank you so much for having me. I'm really looking forward to presenting to you all and being here. So a physiatrist, basically what my specialty is we're a specialty in medicine. It's kind of a smaller specialty, but it's been around for decades. And we focus on rehabilitation, right? And we focus on the functional issues of a patient who has impairments, physical impairments related to a disease or an injury, right? And a lot of us go into various different avenues as physiatrists. Some of us go into sports medicine, some can go into brain injury medicine, spinal cord injury medicine, and there's another up and coming field of cancer rehabilitation that I am trained in, and that's my background. So, and basically what I do is I help support patients throughout their entire cancer care journey, from diagnosis to treatment into survivorship and maybe even beyond. I collaborate with the cancer care team, the radiation oncologists, the palliative care doctors, your oncologists, your surgeons, and help come up with treatment plans to keep you fully functional throughout your cancer care journey and deal with any kind of physical impairments related to cancer or side effects from treatments. And that's my role.
Well, thank you so much for explaining that. And I just want the audience to remember tonight, again, another person that you can turn to in your expanded treatment team. So thank you so much. And Dr. Davidoff, please begin your presentation.
So tonight I'm going to talk about brain fog, and this presentation is entitled "The Hidden Struggle," right? Brain fog and cognitive dysfunction in cancer. I've given a talk like this, similar to in just cancer in general, but I will kind of tie it into the ovarian cancer background as well. And like I said before, I'm a physiatrist specializing in cancer rehabilitation at Lenox Hill Hospital at Northwell Health. So just a little bit of an overview of what I'm going to talk about today. These are kind of my goals. So first, we're going to define and introduce the concept of brain fog and what that is. We're going to outline some common symptoms associated with brain fog. We're going to explore the potential causes with a focus on cancer-related cognitive impairment and discuss how brain fog can actually affect your daily activities, your work, and your relationships. And then present some coping strategies for helping to manage brain fog. So what is brain fog, right? So the term brain fog itself is not a medical diagnosis. This brain fog often refers to the cognitive changes to describe the symptoms of just decreased mental clarity. And as healthcare providers, we actually can refer to brain fog as cancer-related cognitive dysfunction or cancer-related fatigue. And the term chemo brain, so brain fog was actually sometimes termed chemo brain because originally it was thought to be related to chemotherapy. But as we know over time, patients who haven't had exposure to chemotherapy can also experience brain fog. right? So just wanted to kind of define brain fog, and it might be just synonymous with all these other terms as well. So you may hear different terms throughout the presentation. So there was a really interesting study in 2009 in the Journal of Cancer Survivorship that looked into patient testimonials about cognitive fatigue, cognitive dysfunction, and brain fog in patients with cancer. And two of these quotes really stuck out to me that I wanted to read out. So one of them said, "I can't remember just sitting there and thinking. My brain is just absolutely dead. I couldn't think I'll ever be able to think again, and finding it very frightening. I do remember almost being panicked that I could never be able to think of words again, and I wouldn't function." And then another testimonial said, "You have to fight to make yourself remember numbers, words, places that you go. Sometimes I would leave the house to go somewhere, and I really couldn't remember how to get there. And it almost made me break down because the fact that you think you're losing your mind." So these really struck me, and it resonated because I've had feelings like this before, which was very scary. But the reality is, in patients who have true brain fog or cognitive dysfunction related to cancer treatments, this can be even more intense and even more debilitating in day-to-day life. And the idea here is that you're not able to function, right? So that's what I wanted to highlight with this. So what are some common signs and symptoms of brain fog? May have experienced difficulty with memory, difficulty concentrating, trouble with recall. Your information processes is just a little slower than it used to be. You might have word retrieval issues and multitasking challenges, confusion or disorientation, difficulty learning new information or skills, and just feeling overwhelmed, mental fatigue, and difficulty organizing thoughts. Spatial awareness issues and loss of mental sharpness also. So brain fog, it's not just in your head, or is it? So there are studies that have come out that showed that there's actually advanced brain neuroimaging has found dysfunctional changes that can be identified in patients with cancers. And there's this study that showed neuroimaging, an MRI scan that showed decreased gray matter changes in the frontal lobes of a patient 1 month after chemotherapy. And this change is most prominent in those who did receive chemotherapy or hormone therapy. And the particular areas of the brain that were mostly affected were the frontal and temporal brain regions. So the frontal region is responsible for decision-making, planning, and judgment, working memory, abstract thinking, and social behavior. And the temporal area houses something called the hippocampus, which is important for memory processing. So it's not just in your head, but it's kind of in your head because it's changes to your brain. So what contributes to cancer-related cognitive dysfunction or fatigue? It's multifaceted, and a lot of things can contribute to this. So one can be a cancer-related issue, whether it's a tumor itself, the fact that you're just in a pro-inflammatory state, or your body's just in a lot of pain. The next is treatment related, whether it's from the radiation treatments, chemotherapy treatments, and immunotherapy treatments, as we talked about, or just recently coming out of surgery and anesthesia. Others in green are kind of indirect effects, right? Medical conditions. So if you're a person who's had a history of diabetes, thyroid issues, undergoing menopause, have anemia, nutritional deficiencies from inability to maintain a good nutritious diet, or if you're just on a lot of pain medications that are kind of clouding you as well. Psychosocial stressors as well, having anxiety, depression, poor sleep, lack of social support, and again, pain. These are all things. So really what it comes down to is brain fog is multifaceted. It's a lot of different things. And rather than it being one thing or just one structural problem of the brain, it could be multifocal, multifaceted, right? A lot of different things contributing. So our management is as such, making sure that all these pieces are addressed. Stephanie, if you don't mind, if I could just pause one moment because my laptop battery is running out. I just want to grab that real quick. Okay, so how do we diagnose brain fog? It's such a complex condition, actually. It sounds like such a simple term, but it's actually quite complex, as we described before. So it is difficult to diagnose, just because these symptoms mimic so many different conditions. Like I said, thyroid issues, anemia, menopause, all these different things can mimic cancer-related brain fog. So doctors actually, like myself, actually have to rule out other problems first. We may order some labs, which I'll get into. We may obtain some imaging of your brain to make sure that nothing else structurally is going on. May require a neurologic evaluation. And if all of that checks out, we might even send you for a neuropsychologic testing. That might be considered too, to kind of tease out what issues, higher level processing issues may be going on. So it really is a complex condition that's quite challenging in terms of diagnosing, but it's also a clinical diagnosis, meaning it's cancer-related cognitive dysfunction or fatigue, which we assume is related to all these different issues going on. So it's kind of just like an umbrella term, usually. So what are the risk factors for this? Number one, the type of cancer, right? So someone with ovarian or breast that, you deal with a lot of like kind of hormone related issues, may have different kind of levels of cognitive fatigue than someone with a different kind of cancer. And of course, someone with that actual structural issue in the brain might present differently as well. A high cancer or tumor burden. So later stage is higher risk for having this as well. The type of systemic treatment someone may have, and how long they are on the undergoing chemotherapy. Higher doses of chemotherapy and higher doses of radiation is also a risk factor. Older age is more susceptible. You don't have a lot of like neuroplasticity as someone who is younger. Some people just have a genetic predisposition to having more issues. Your prior health status may contribute as well. As I mentioned, if someone has a lot of other medical comorbidities or issues, that may also be a risk factor for developing this. Poor nutrition is also a risk factor. So this is a question that I get a lot. How long does this last? This may not be the answer that everyone wants to hear, but it truly is highly variable based off of the risk factors, as I mentioned in the previous slide. So for majority of people, studies have shown that this can dissipate over time. So about like a year or so after completing chemotherapy and treatments, but 10 to 30% may still have long-term effects. And that seems like a small number, but in the grand scheme of things, that's a lot of people that may still have lingering side effects. And risk factors and medical conditions can influence this duration. As I mentioned before, if someone were to have a host of those risk factors, they might develop more long-term side effects than someone who doesn't. So how exactly is this diagnosed? Where does my evaluation start, and what does it entail? So for one, I take a detailed history, right? I learn about your oncologic history, the treatments you've had, the surgeries you've had, the types of medications you're on, and other medical issues that you may have. I do a symptom assessment to see what other symptoms that you're having, whether it's pain, issues with sleep, your mood, your nutrition status. Are you eating enough? Any signs and symptoms of like menopause, those types of things. Physical exam evaluation as well. For me, it's really important to do a really thorough neurologic exam to make sure there's no what we call red flag symptoms like focal weakness or any other neurologic issues that could be contributing. Laboratory tests I may order, or I may involve the oncologic team to order some tests, such as vitamin levels or thyroid studies or hormone levels, just depending on the picture of the patient. Again, imaging tests, if I notice there's some weakness or gross findings on an exam, we may order more tests, whether it's of the brain or the spine, just to make sure we're not missing anything. Doing a thorough medication review. I mentioned that pain can be a factor, but also pain medications can also be a factor and contribute to brain fog. It's important to get patient and caregiver input, right? If patients, excuse me. Sorry.
Do you need to grab a glass of water, Dr. Davidoff? Please feel free to do so.
So again, patient and caregiver input. If the brain fog or the confusion is pretty severe, getting input from a patient's family members about any personality changes or anything that's going on. And it's very important to monitor over time for any kind of changes, any worsening of symptoms. And as I mentioned before, I make sure I collaborate with the cancer care team. So what is the impact of brain fog or cognitive dysfunction on quality of life? And I think you all can answer that for yourselves, right? Better than I can. But the main cognitive domains that are affected with brain fog are memory, multitasking, word finding difficulties, task organization, slower processing, and decreased executive function. And executive function is just the anything that we need to execute skills. And how does this affect quality of life? Well, may lead to additional depression and anxiety, decline in job performance, avoidance of social interactions, isolation, distress due to lack of acknowledgement in the medical community, which is actually a real thing. And I think the issue with that is that there's so much unknown in this process, in this disease process. And there's a lot of unknown. The strain between family members, increased caregiver burden, decreased independence, lack of self-esteem, and decreased self-worth. And more importantly, I wanted us to be aware of the red flag signs and symptoms of when I'm evaluating a patient. I always ask for questions regarding symptoms of new or persistent headaches, any balance problems, or any weakness or numbness in any part of the body. Because for me, this may trigger additional imaging of either the brain to make sure that there's nothing else structurally going on. So, impact on quality of life. What are ways in which brain fog and cognitive dysfunction related to cancer can affect our quality of life? So the cognitive domains that are really affected is decreased executive functioning, slower processing speed, task organization. Patients may have word finding difficulties, multitasking, and memory issues. And how does that affect your overall quality of life? Well, can add to depression and anxiety, decline in job performance, avoidance of social interactions, more isolated, distress due to lack of acknowledgement in the medical community, strain between family members, increased caregiver burden, decreased independence, lack of self-esteem, and just a sense of decreased self-worth. So again, I wanted to talk about the red flag signs and symptoms. I always ask patients a few questions about symptoms that we need to be aware of, because this would trigger additional workup. For example, if a patient were to tell me they have new or persistent headaches, new balance problems, or new weakness or numbness in any part of their body, and I find that it corroborates on an exam, I may be more inclined to order additional imaging to make sure of the brain, to make sure there's nothing structurally going on there. So how did this apply to patients living with ovarian cancer? So as we know, there's increased number of individuals living with ovarian cancer in the US, right? This increased survivorship numbers is really exciting as a result of all the advances in treatments and surgical interventions, and this is overall very positive. But many survivors report ongoing symptoms and decreased quality of life. And this cancer-related fatigue and brain fog are actually reported to be the most distressing symptoms, according to studies. So nearly 70% of women with gynecologic cancer who underwent chemotherapy actually report cognitive dysfunction. And one of my patients actually told me this that actually resonated with me, and it stuck with me till this day. She feels like she's surviving, but she's not thriving. So at this point, I wanted to ask you all to write in the chat a little bit about what brain fog looks like for you. How does it affect you? And if you don't mind, I would like to read some of the comments. How has it impacted your quality of life?
So you want to make sure you put your answers in the chat feature.
Okay. Suzanne said she feels mentally dull at work, and you're in the medical field and you don't even trust yourself. Wow. Forgetting words, difficulty making decisions, lack of focus, trouble remembering words and people's names. Don't have a complete train of thought and you lose your thoughts sometimes. Wow. Problem focusing and frustration, problem learning new things for work. You feel overwhelmed and multitasking is very difficult, feeling like my brain doesn't work as it did before and never will. You have a technical job, Lisa, so you can no longer do all the work, so the technical aspects of it. It's careless mistakes with detailed tasks. You forget everything, dates, names, memories. Oh my God. Memories. I have to make more lists so that I don't forget. So Sherry, you're starting to do some coping strategies. You feel stuck all the time, extremely depressed, overwhelmed. Emails more than a paragraph are overwhelming. I can relate to that. Recall of words on occasion. You're not able to perform at the same level, concentrating to read a book. Hard to make decision. You feel loss of independence. Wow. Thank you all for sharing that. Yeah. So a lot of patients have told me they can't do the things that they love to do anymore because it actually takes a lot of effort and a lot of work. So things like reading a book that used to give them some enjoyment, or watching a movie or playing an instrument, it's too effortful, and that kind of goes into you losing your sense of self and your identity because it's the stuff that you no longer can do that you did love to do. And a lot of comments about not being able to maintain your job, and for a lot of us, especially in the medical field, this is your identities versus for a lot of us, your job has become your identity. You feel embarrassed and feel that medical doctors don't take it seriously. And thank you, Heather. And I think that's for some of us that may be true, because there's so much that's still needs to be researched within this area and this space, and there's a lot of unknown, and it's just a lot of complexities that come into this diagnosis. Thank you guys so much for sharing that. So I wanted to move on and talk about a patient that I have, and a case study. Okay. This is a 56-year-old woman. She was diagnosed with breast cancer, and she's underwent a lumpectomy and radiation therapy, and she was treating with hormone therapy, namely tamoxifen, and she was complaining of just persistent fatigue and brain fog and not being able to do her work. She had difficulty concentrating. She felt forgetful, distracted. She felt really weak and tired despite getting enough sleep. She had a lot of neuropathy symptoms and very painful joints related to her cancer treatments. This caused her to have just depressed mood. I mean, she was overwhelmed with everything. And she was actually a pilot. So you can imagine that it was actually very important for her that this is the most distressing complaint that she had because she couldn't do her job well. And she also lost her husband a few months ago, and so she had many life stressors. So before I get into what I did with her, I wanted to go into some coping strategies because we implemented some of those things. So how do we cope with this cognitive dysfunction? And what are some of the treatments that we have? So first and foremost, a medical evaluation and interventions. It's so important to discuss these symptoms with a medical doctor. And I get that, some of us might feel embarrassed or feel siloed or feel like dismissed. But really important to continue to have that discussion with your medical doctor to make sure that it's not something else isn't going on. Treating underlying medical conditions, as I mentioned before, if you have a history of hypothyroidism, menopause, hormone imbalances, nutritional deficiencies, those things, first and foremost, is treating any reversible causes for fatigue. You may, if you do have a cancer rehabilitation specialist available where you are in the Cancer Institute or locally, maybe a referral to a rehabilitation specialist like myself to get a look at things holistically. And this may include a PM&R doctor like myself, a physiatrist, but these cancer rehabilitation specialists can also be physical therapists or occupational therapists. Symptom management is going to be really important here. So managing pain and trying to find the balance between pain medications and difficulty with fatigue and cognition, because a lot of these pain medications can cause fatigue. So really important to talk to your doctor about the pain you're having and seeing maybe an orthopedist or a rehab specialist to kind of tease out the pain you're having, because not all pain in someone with cancer is cancer-related pain. You can have pain related to arthritis that doesn't need to necessarily be treated with an opioid that can cause you more fatigue. Sleep aids. If you're not getting enough sleep, we might suggest something like a light sleeping supplement like melatonin or antidepressants as well to help with mood symptoms and sleep symptoms. And if everything else has not been as effective, in some select patients, we may consider stimulants. And these are medications similar to what we give to patients with ADHD, like modafinil or Provigil. And this really is to help improve concentration and attention. But important to note that these stimulant medications may have a host of other side effects that so it's really important to have a risk and benefit discussion with a doctor if one were to start a stimulant medication. And last but not least, time. Time after completing treatments, time and patience in order to is one of those interventions. Another intervention that we may refer patients to is cognitive and occupational therapy. And these are more strategies for compensatory strategies, right? So cognitive therapy may include neuropsychologic testing, which is very comprehensive, cognitive training and behavioral strategies with a certified psychologist or neuropsychologist, or we may refer someone to an occupational therapist to help strategies on activities of daily living, like dressing, cooking, toileting, and driving, sequencing activities, work integration, and just help in just social participation activities. Another area that intervention that I like to talk to patients about in combating cancer-related fatigue or brain fog is exercise and physical activity. So the thing with cancer-related fatigue, as you see in the first evidence here, there's strong evidence that exercise can improve these outcomes, including a bunch of other outcomes such as anxiety, depression, physical function. But cancer-related fatigue was one of those outcome measures that have shown to really improve with incorporating exercises and physical activity and just moving your body on a day-to-day basis. So the American College of Sports Medicine actually put forth recommendations for patients with cancer to combat cancer-related fatigue, and they recommended aerobic resistance training or a combination of both. And so I usually like to counsel patients on how we're going to incorporate physical activity in your day-to-day. And every patient is individual, right? Someone's exercise program might not look the same as another because someone might be undergoing active treatments or have a lot of fatigue where it's just very difficult to get up and moving. So I try to tailor it to the patient. Other coping strategies. So some things that I also like to talk about with patients is ways to stay organized. And this may include apps like calendars or making lists, any kind of memory aid, mindfulness and relaxation techniques. We might talk about those. Again, physical activity and the importance of doing that. Some cognitive exercises, and this can include things like puzzles or Sudokus or, some kind of workbooks, just as intervals throughout the day, just to get your brain kind of stimulated, but not causing you additional fatigue. Talking about taking breaks or making tasks, breaking down tasks into smaller steps so things are not so overwhelming. Having SMART goals, so goals that are attainable and timely and that are achievable. Getting adequate sleep. Talking about sleep hygiene is usually a big part of our conversation. Having a balanced diet, sometimes that may lead to a referral to a nutritionist as well. Hydration is key. I'm guilty of not drinking enough water in the day, and sometimes that contributes to just my overall fatigue, and that might be exponential in someone who's already has brain fog. So making sure you're hydrating yourself throughout the day. And limiting a lot of distractions. And of course, last but not least, having acceptance and having patience with yourself. And I did want to take this time to mention, how great it is if we all have access to like an iPhone or a smartphone of some sort to leverage these phone applications, using things like Google Calendar or a Sudoku game, tracking your steps with heart health, setting multiple alarms for reminders, the Calm app or Headspace apps to help for like guided meditation, making lists of things to do, reading apps, those kinds of things, and fitness apps, really looking into applications that could just make your day a little bit easier for you. And of course, there's a lot of support online, resources online that you can look into, such as organizations on like the American Cancer Society or Cancer Care or National Cancer Institute, just for more information about cancer-related cognitive fatigue or dysfunction. Looking into support groups and forums like this amazing support group, as well as the Cancer Survivors Network or Smart Patients Online, which are another online forums. Different books. So there was one book that a patient mentioned to me that was on my list. It's called Your Brain After Chemo: Practical Guide to Lifting the Fog and Getting Back into Focus. And I know that there's a lot of other books published on these topics. And then, of course, talking to your healthcare providers and supportive care teams, which include an oncologist, a physiatrist, nurses, or other healthcare providers. So back to the case study. As we mentioned, this was the patient with breast cancer on hormone therapy, persistent fatigue and brain fog. So our plan, what did we do? So I ordered some lab work, and I noted that she had a vitamin D deficiency, but her thyroid function and vitamin levels were actually quite normal. So we just started a vitamin D and calcium supplement, just to cover our bases there. We updated her surveillance imaging with oncology, so make sure that we kept them in the loop. She didn't have any focal issues on her exam, so didn't feel it necessary to get any other advanced imaging of her brain, which was reassuring. We did start an antidepressant. For her, her mood was a significant part of this, given the fact that she lost her husband a few months back. So starting an antidepressant to help her sleep and some of the anxiety symptoms that she was having. We also started gabapentin for her neuropathy symptoms, because again, pain, just being in a lot of pain, you can just be easily distracted by that as well. So making sure that that's taken care of as well. And gabapentin is actually a nerve pain medication that can actually be quite sedating. So recommending the timing of certain sedative medications to be more at night rather than being administered during the day. So you actually can use the side effect to help you with sleep. So sometimes changing the timing of a medication is what I will instruct patients to do. And of course, if she's really having trouble sleeping, adding melatonin for a sleep aid to make sure that that's covered. We also talked about starting a low impact gradual walking program or jogging program, just to get her body moving, and just feel a little bit more refreshed. And she had good days and she had bad days. So we made sure that if she didn't meet the recommended activity guidelines, that, she would attempt to do that and get her steps in. And we also discussed some coping strategies to help improve her organization and memory skills, like using different apps. I know she was one that she would always misplace her phone. So one of the things we decided to get was a lanyard that you attach your phone to, and it's always around her neck and she never loses it. So she was grateful for that. And I did want to say that this patient allowed me to share her story. And this patient is actually my mother. And she went back to work, and she went to school and got a new certification for flying a different kind of plane. And she was able to go through school and study and come out at the top of her class. So really, really proud of her, but it was really a struggle for her to combat this kind of brain fog that she was having from her treatments. So, when that being said, thank you, everyone. I want to welcome any questions or comments to add to this discussion. And yeah, the floor is yours.
So Dr. Davidoff, first, I'm just going to say how kind that was for your mom to allow you to use her as the case study. And we really do appreciate you being able to share that with us, because that is really important and something that is very private. So thank you, because you understand then firsthand, after what you experienced with your own mom, what patients are going through. So truly, thank you very much for that.
Of course.
Okay, ladies, does anybody have any specific questions? Because I had some that were sent to me prior to the program, so I just want to see. Well, I'll just read a comment. This is most beautiful and inspiring presentation. I feel seen. So thank you very much for that, Dr. Davidoff. Thank you, Claire, for sharing those kind words. That was really important. Thank you very much for sharing that. So Dr. Davidoff, I'll begin with a question. So if a patient has to be on medication such as the aromatase inhibitors, because this will hopefully keep their cancer from returning and keep it at bay, and they have severe brain fog where they are putting notes up around the house to give them reminders about doing things, and they've had to switch careers because of those factors. What are the first steps in trying to help them, baby steps? If somebody needed to try, there was a full list of coping strategies. What do you recommend as the first thing that somebody tries?
I would say that if trying to understand what is the most distressing symptom to them. For some, it's just, if it's something like I'm just forgetful, then that's where I would kind of hone in on that and try strategies for like memory aids. If the most distressing symptom to a patient is pain or depression, then I would kind of go in that direction. So it really is individualized for the patient. And so it's not a one size fits all, if that makes sense. I think it's just having a conversation about what is your main concern, and then we dive into that and then find a coping strategy for that specific thing. Because I think it's important to be specific with your management, to make things like have SMART goals, make them attainable and achievable, so that way it's not overwhelming, right? Because there's so many things that we can do, but I think that addressing the main symptoms first and doing little things for that, if that makes sense.
I think that does make sense. And kind of, as you said, breaking things down so it doesn't seem as so overwhelming.
Exactly.
We got a great question. Are there any specific medications that target cognitive dysfunction in general?
That's a very good question. I'm glad you asked that. So as I mentioned before, there's nothing specific for cognitive dysfunction, because remember, cognitive dysfunction can be just as a result of just, mood or anxiety or pain, or due to pain medication. So oftentimes it's taking away medications that have side effects for cognitive dysfunction. That's usually what I'm doing, is patients are on a slew of medications, on so many opioids, on so many sedating medications. And sometimes it's either taking away or changing the timing of them. But if everything is already kind of stable and they're not on a lot of medications, they still have cognitive dysfunction, that's when we'll maybe talk about adding a stimulant medication like Provigil, modafinil. But those medications I would talk about with the rest of the oncology team to make sure that, those have side effects as well. For example, patients with cardiac histories, like I don't want to give them a stimulant medication if it's going to increase their heart rate, or, so it's very individualized. But there's not something specific to target cognitive dysfunction. It's usually a stimulant, or it's usually modifying the medications that they have, changing the timing or taking things away that are sedating.
Okay, thank you for clarifying that. That's greatly appreciated. So another question that has come in through the chat is, if somebody's doctors, whether it's the primary care, the oncologist, are not necessarily being proactive about taking somebody's brain fog into consideration and the frustrations that they're going through, and that somebody, depending upon where they are in their journey, is considered to be past that point, who else should they go to take the lead on focusing on this situation that they're facing so many challenges with?
Yeah, I hear you, Heather. I would say if you do have access to a cancer rehabilitation specialist, that would be great. We can do assessments of, we treat things like cancer-related fatigue. But and you can easily try and just see if do a Google search and see if your Cancer Institute has cancer rehabilitation services, and see if there is a PM&R physician who's part of that program. But if not, just trying to find the resources, and again, online that I mentioned before, or seeing if you can be connected with a psychiatrist who has the ability to use medications that, may help with mood or like anxiety, depression, those kinds of things, if those are your main symptoms.
Okay. And also psycho-oncologists, sometimes those are at some cancer centers as well, as another field that could possibly help with helping patients who have brain fog.
Oh, can you say that again? Do you have any info on
psycho-oncologists? So the psycho-oncologist, is that another person that you could turn to for guidance as well, if that is an area of specialty at specific cancer centers?
Yes, I would say psycho-oncologists and specifically neuropsychologists. Neuropsychologists are very good at doing a full assessment of, your executive functioning, your memory, all of those things. And they can also often provide behavioral therapy.
Excellent. Susie would like to know if you could share once again the names of the apps you recommended on the slides to leverage the phone apps, if you wouldn't mind.
Absolutely. Some of the apps that I like to recommend are, if you're one that likes Sudokus and puzzles, you can look up puzzle apps. Headspace is a good one, and the Calm app to help with just like guided meditations, and this is not sponsored, by the way. Guided meditations and just like calm before sleep, breathing exercises. Everyone, if you do have an iPhone, using the health app, I like to have patients like track their steps just to make sure that they're moving their bodies enough and meeting those physical activity guidelines, trying to reach for at least 10,000 steps a day. So that's like an easy one we already have. Google calendars, I forget everything. I'm one that needs to have everything on a calendar. So I love my calendar app, and any calendar app will do. Your alarms, use alarms to help remember things. Your note apps are great as well. And just really, if you can go into dive into a black hole of applications that are on the phones, but those are the main ones. But I'm sure there are a lot more, but those are great ones to start with.
Thank you for sharing those on Calm app. I know a lot of women use that one, so definitely look into that one. Another question that came in, could you speak to if the PARP inhibitors that the patients are on as maintenance therapy, do you know specifically if there's any relation to taking PARP inhibitors and brain fog specifically?
I don't know if to my knowledge, if there's any specific association with it, but anything that, usually any kind of systemic treatment that's affecting hormones or tumor cells and changing things, chemistry in your body, can cause some changes in your cognition. It can be a side effect, but I don't know of any specific studies that show this association for a PARP inhibitor. But I will say, if it's directing, like you said, if it's causing, issues with anemia can cause more fatigue. So it almost can kind of indirectly cause more fatigue and brain fog. So, as long as you're being closely monitored, but with your primary care doctor, with your blood work, and making sure to asking the right questions, like, oh, do I need supplementation? Do I need iron? I'm sure they would be happy to answer questions related to that.
Thank you for sharing that. Great advice. And again, any supplements, you want to go back and make sure your team, right? So this is a really great question. After we've all seen the ramifications of COVID, if somebody's had COVID 2 times, how would they know if brain fog is COVID related or cancer related, or would it even make a difference?
Such an interesting question and a great one, but we have been seeing, from COVID specifically, long COVID syndrome that can contribute to brain fog too. So it's a very similar syndrome to someone who has brain fog related to cancer. This pro-inflammatory state of cancer and COVID just really causes this overall fatigue in the body and the mind and everything. So these can be lingering fatigue symptoms. And I don't, in terms of management, it may not make a difference. It's really just, it's very similar, but your radar is on different things. So for a person with cancer related fatigue, we're looking at making sure they don't have anemia, making sure they don't have any other symptoms that may trigger us to get new imaging. For someone who just has COVID related fatigue but no history of cancer, that might not, I might not be as quick to want to get labs or imaging. But really, if you're one who had COVID and you have cancer, they can both contribute and maybe even cause even more fatigue than usual. So over time it gets better, but it does linger. There are studies that show long-term effects of like long COVID syndromes and stuff. So
Okay, a really important factor to keep into consideration. And I would like to thank Susan because she actually put in the chat water tracker by Fun Media is her go-to for hydration management. So I think that's something that maybe everybody could look into because making sure you're drinking enough fluids throughout the day could possibly help. But Dr. Davidoff, before we close, I have a question that came in before we started tonight's program from a survivor from our community. Do you have any suggestions or recommendations about how somebody could speak to their family about this subject matter so there is less frustration on both parties' ends? And so this way also there's a little bit more sensitivity given to the survivor under their circumstances. They're not meaning to forget things, it's just happening. And so do you have any suggestions of how to speak to people so we can kind of give everybody some guidance in that?
Yes. I can just give you some personal experience with my mother, who actually did have a lot of, memory and foggy brain fog symptoms. It was really hard for us to be patient with her, right? But opening that conversation and just talking about it, and just, like you said, just making your family be aware of these symptoms and that we're trying, and always just having that conversation with your family members is really important, and being open about it. I think what she told me was that really made me aware of how it affected her was when I think she told me something like, it's like I'm trying to learn how to write with my other hand. It's just taking me like a lot slower to learn to do things again because it's not my usual, and it just kind of put things into perspective. So try an analogy of like, to make them understand that things are just a little slower, and maybe that'll help.
Okay, well, thank you very much. And I want to say to everybody, thank you so much for participating in tonight's program. I know that this is a complicated, I should say, side effect that many of you endure because of your treatments. And Dr. Davidoff, thank you for the valuable information that you provided. And I hope it helps you all to be able to ease your minds a little bit and find different ways to cope with it. And just know it's real. We understand it and we see it. So thank you, Dr. Davidoff, and thank you all for joining us tonight.